Good evening, everyone. Namaskar, namaste, and a very, very warm welcome to yet another learning session from Annie Patient Safety Fellows based on evidence-based, actionable practices. Please do not put on your video and please do not put on your audio also, because I'll be quickly inviting our speaker for the day. Just give me a minute. I just have to do the introductions and then I will be calling Ms. Papori. 1 second. So, ladies and gentlemen, as you are aware, we had been doing this from the beginning of the month. And fortunately, we have kept up our promises. We had been doing all the sessions we missed in September. So we are holding 2 sessions in October. And so in October, I told you all the topics are being brought to you by Annie Patient Safety Fellows because of our commitment to patient safety. Association of Nurse Executives India believes in preventable zero harm. And I'm very sure that all of you are also here because you believe in that too. So I am not going to repeat the definition of EBP. It only means that whatever practices that we do, it must be somewhere shown as an evidence that is available. I'll just request Papori, can you admit the people while I am talking? Thank you. So that's the calendar we had for 2024. So we are sitting here in October, hand hygiene. We have 2 more sessions that are going to be done for the remainder of the year. The next one is on pressure ulcers by Ms. Ramya and Krishna. And the last one is ventilator-associated pneumonia by Elizabeth Wolke, supported by Vinod Kumar. So you can all read what is up there, that anything that we practice, it should be based on some up-to-date research and knowledge rather than traditional methods. Many things that we do, we are doing because we learned many years ago and we had been doing it that way, and we believe that's the right way. It is not necessarily. All these learning sessions are to bring to you what is available as evidence out there. And the base documents are coming from Patient Safety Movement Foundation, with whom we are collaborating in the Patient Safety Fellowship Program. So today's topic, hand hygiene, is going to be done by Ms. Papori Pathak Chaudhary. She is our Annie Patient Safety Fellow, and I am only there to give her moral support and pitch in between, because I have promised to be with her as per our calendar. So I'm here, and I try to mentor all the patient safety fellows. It's only because I am firmly committed to patient safety, and I think whatever that we do for the sake of patient safety is never enough, because environment is so complex. So next in November, again at 7 p.m. That's Ramya and Krishna who will be discussing on pressure ulcers. 2025, maybe we'll come to you with more interesting learning sessions. So that is all. Thank you. And before I call in Papuri, just for you to think about hand hygiene, to set the tone, instead of me introducing hand hygiene, because everybody might be thinking, what is there to talk about hand hygiene? It is pretty basic. Yes, it is pretty basic. It is the cornerstone for preventing infection in our patients in our hospitals. But let me show you a video to show you that how safe or how safe we are not. So just give me a minute. Let me just make that bigger. Can you confirm that you can see the picture? Can you?
Yes, ma'am. Yes, ma'am.
All right. So I'm going to run this video, and by the time we finish, I have only one question. After seeing this, you tell me that how yellow will be our hospitals. So this is starting with the patient who is considered infected, because that is what is standard precaution. Every single patient who comes to our facility is considered to be infected. So from there the story starts, and let's see where does it go. Okay, friends, I hope that has, given us some insights. So my question is, how will be our hospitals? Looking at the way that infection can spread so easily, can you put answers in the chat box, please? How best will be our hospitals, How so while you are answering how yellow will be our hospital, for patient safety, we actually our buildings orange. If only we could see that how we are spreading the germs. I'm pretty sure that all our hospitals will be glowing yellow. It's a proof that we are not doing hand hygiene enough. And that's what the evidence also says. So with that, it gives me great I mean, great happiness, not opportunity, happiness and a proud moment to invite Papuri to the screen. Can you put the video on, Papuri?
Good
So,
evening, ma'am. Good evening, everyone.
evening, please tell your few words of introduction so that the people know you a little bit more, and then you can start your session. I'll be off the video of the audio. I will
Sure.
be, I think there is a need, otherwise towards the end, I will definitely come. And I would be asking all the participants in case you have any thoughts or any questions during the session, please start posting them in the chat box and we will look at it at the end of the session. Over to you, Papoli.
Thank you so much, ma'am. Good evening, everyone. And we welcome to this learning session of patient safety fellows. And I am Kapuri Pathak Chaudhary, currently working as an associate professor in Asian Institute of Nursing Education, Guwahati. My specialization is in pediatric nursing. And at this at the onset, I want to give a heartfelt thank you to Madam Thongkam Gomez for giving this opportunity. And also, I am grateful to ANEI along with Patient Safety Movement Foundation USA for giving me the opportunity to be a fellow of this patient safety movement. So moving on to today's session, it must be thinking why we need to discuss hand washing. Already, Madam has shown us the video, like how yellow we are. Maybe it has already provoked a thought in your mind. So in order to discuss something more, the evidence-based practices which has been brought out by Patient Safety Movement Foundation USA, let us see some of the crucial, informations. Some information maybe already you know and some may be new to you. So without much delay, let me start with this presentation. Just give me a moment to pull up my slides. Just a moment. Is my slide visible, ma'am?
Yes, Papuri, yes. You can put it on slideshow. Yeah, that's it.
Yeah.
Good.
Okay. Thank you, ma'am. So to start with the hand hygiene, when we talk about hand hygiene, what comes to our mind? It's just a simple, very simple step, isn't it? But it has got a lot of power. You know, as Madam said that we have to break the chain. So this is the powerful tool which can break the chain and we can stop or prevent the infection spread. Hand hygiene, when we say it is just the cleaning of hands, there are certain steps. We have to use soap and water or something to clean our hands. But there are so much, WHO has given so much emphasis because it is the fundamental practice to ensure patient safety and reduce healthcare associated infection. When we look at the magnitude of healthcare infection, associated infection, we'll be shocked to see not only the developing countries, but also in the developed countries, the percentage or prevalence of HAI is so much high, which can merely be prevented only with practicing good hand hygiene. So if we see the prevalence, globally, it is estimated that 100 patients, out of 100 patients, 7 in high income and 15 in low to middle income countries contract or acquired HAI, 1 in HAI in acute care hospitals, and 1 in every 10 affected patient dies because of HAI. 8.9 million HAI occurs every year in acute and long-term care facilities in European Union or in European economic areas. So this is the global picture in a very nutshell. When we look at in the Indian perspectives, the prevalence of HAI in India, the prevalence rate shows 9.06 infections per 1,000 patient days in each intensive care units, as well as the rate of infection. I want all of you to put attention to this figure. 4.4% to 83.09% across different hospitals of India acquires hospital acquired infections. This incidence of HAI in ICU in India ranges from 9.6% to 17.7%. So this is a huge burden which can only be prevented, or it can simply prevented by using hand hygiene. Now, if we look at the international prevalence from different countries, we see the highest rate is from Canada, that is 10.5%, and USA is the least, that is 4.5%. And others, all the countries, it ranges between 4.5 to 10.5. And as I already mentioned in the previous slide, that India ranges from 4.4 to 83%. That is a quite huge percentage. Now, if we look at the historical perspectives of hand hygiene, how it evolved or how it developed as a component of infection prevention measure, so it tells us that while like hand washing, it is a like common practice. Everyone uses or everyone does hand washing, but the focus has been it has been started in the mid 1800 when two Hungarian physicians or Hungarian surgeons they have spelled out the importance of hand hygiene. They are Ignaz Semmelweis and Oliver Wendell, and Ignaz Semmelweis is also known as the father of hand hygiene. On May 15, 1847, Ignaz Semmelweis has announced that merely scrubbing your hands with chlorinated lime reduces the mortality rate among the maternal mortality rate among the puerperal fever patients. It has been proved with his like using the chlorinated lime for scrubbing hands, and but then it didn't get that much importance. They got some resistance and it was not widely accepted. Then later on, the work of Florence Nightingale, we all know the hygiene theory Miss Nightingale has developed. In her notes on nursing, she has mentioned the importance of hand hygiene, how hand hygiene can reduce the infection among like the patients. And she has also emphasized that every nurse ought to be careful to wash her hands very frequently during the day. Miss Nightingale has given so much emphasis on hand hygiene. In 1980, there was a pivotal movement with the guidelines being established by National Hand Hygiene Guidelines, which tells us the importance of hand hygiene and also the steps to be followed. Later on in 2000, a multimodal strategy implemented at Geneva's University Hospital, which demonstrated that sustained when we improve the compliance of hand hygiene, it reduces the healthcare associated infection. And this very multimodal strategy has influenced the WHO to come up with the World Hand Hygiene Day campaign. And this was on the May 5th, 2019. And there onwards, every year we are celebrating this World Hand Hygiene Day on 5th of May. Now, like why we need to know about hand hygiene or what to know about hand hygiene. So the evidence-based literature says research shows that microbes causing HA are very commonly spread between patients on the head of healthcare workers. The healthcare workers are only the vehicles. Their hands are the vehicles of spreading the infection from patient to other patient. Patients carry microbes and without showing signs of infection, the microbes, it remains on their hands if they do not clean it properly. Staff hands are can be contaminated with merely simple procedures like checking pulse, taking temperature, checking blood pressure, even touching the patient or patient's surrounding. The staff or healthcare members may get contaminated. On any given day, 1 in 31 patient has at least one HAI. And hospital staff hands are the most common means of transmitting infections from patient to patient, and which increases the risk of longer stay, also readmission among the patients. Now, what is the relationship between hand hygiene and the infection, healthcare associated infection? This is very much established. The hand hygiene inversely proportionate to HAI, and like across hand hospitals, it cost about 57,000 US dollars annually for 2,600 bed just to prevent or just to combat this hospital acquired infection. There are certain mandates and regulation which has been proposed in like the Western countries, and this one is given by Joint Commission. As of on January 1st, 2018, Joint Commission has begun citing that individuals' failure to perform hand hygiene in direct patient care as a deficiency prompting a requirement for that means that the healthcare medical providers accreditation can be at risk if the staff members or the healthcare team members do not follow or they are non-compliant to hand hygiene. Then another regulations or mandate is given by the Center for Medicare and Medicaid Innovations for implementing the electronic hand hygiene compliance monitoring system. So these are two guidelines which has been brought up by the Patient Safety Movement Foundation's evidence-based literature. But when we talk about Indian healthcare setting, do we have any mandate? If anyone is aware of any mandate or regulation, kindly drop it in the chat box. So as per the literature search, we could not find any established guidelines or regulations or mandates from Indian healthcare scenario. However, Indian healthcare sectors at different levels, they are following the CDC guideline, WHO guideline, as well as ICMR guidelines for hand washing. Now, if we see the cost, how much does it cost when we do not comply with the hand hygiene? HAI are the most common adverse event in hospitalized patients, and globally it costs around 28 to 45 billion US dollar every year. And these are the data from the European and USA. So the European and annual financial loss is about 7 billion euros, and with an estimated 16 million extra days. 16 million extra days overall for all patients yearly. And the number in US, it is the amount is 6.5 billion US dollar annually. They have to spend only for fighting with this HAI. It is estimated that every $1 spent on hand hygiene compliance improvement is associated with the benefit of 23.7 dollar. That is the research findings shows that if we spend only $1, it saves our $23.6. Additionally, it in 2008, Medicare opted for non-payment of US hospital. This is the medical insurance or medical coverage by the government. They have stopped giving the coverage to all those hospitals where the patients had the history of contracting with the HAI. There are predetermined 8 numbers of HAI. If any patient contracts or acquires any one of these HAI, the payment is stopped. HAI prevention efforts via hand hygiene are estimated to save nearly 35 billion US dollar annually. This is a huge amount of money which can save merely practicing hand hygiene among the healthcare team members, also among the patients and the family members. So moving further, what can be the solution to this problem? HAI, how can we stop HAI? And what are the other steps to be followed? So healthcare organizations have successfully implemented and sustained improvements to increase hand hygiene compliance. The leadership checklist is the primary thing and very important that every hospital must apply this. And there should be monthly monitoring. Every monthly basis, there should be audit, there should be monitoring, there should be feedback. And if there are number of HAI increases, then it should be done more frequently. The solution strides are implementing the implementation and culture. So there should be some performance improvement projects which can be implemented in the hospitals to improve the performances of hand hygiene, and the target should be kept 100%. We do not set the target as 80% or 90%. It should be 100%. Frontline involvement and competences. This is very, very important. All the frontline workers and also all the team members of the healthcare sector, they should be trained, they should be educated, they should have the competences, they should develop the skills, and there should be a standard checklist whether they are aligning on with the practices or not. And it should be ensured that all the new hires, new recruitees, or floating staff, they must be trained and they should follow the standard methods. There should be regular monitoring and observation. And it is the best way to monitor hand hygiene compliance by monitoring the number of rate of HAI. If we see that the HAI rate is less, that means hand hygiene compliance is increasing. And if the rate of HAI is increasing, that means the hand hygiene compliance is decreasing. So, moving on to the clinical workflow, I think most of the healthcare team members, as Madam has showed in the video, and also the patient and family members, they do not realize that harmful pathogens can live on their hands. So, henceforth, a bold, like, very bright and big and like very eye-catching poster should be displayed in all the areas where, like the bathroom, near the lounges, in the hospital wards, everywhere there should be posters which I mean it gives the what to say, encourages the health team members or reminds the healthcare members so that they can do the hand washing. Moving further, now this is a question I would like to ask all the audience. What do you think? Who lives on our hands? Can you quickly drop in the chat box as like who lives on our hands? We all know that microbes are there, but which type of microbes are there in our hands or on our hands? Okay. Uh, so there are two groups actually. One is called the resident flora or resident bacteria, and another group is known as transient bacteria or transient flora. Now the question is like which flora or which group is harmful for us? Can you drop in the chat box which group, resident bacteria or resident flora or transient bacteria? Which group, according to you, is the harmful for human being?
We are getting answers as transient.
Okay, that's very correct. So transient flora, will come to that in the later slides. Let us see what are the resident bacteria and transient bacteria, what are the differences between them. So this resident bacteria or resident flora, these are the microorganism normally lives on our hands. It also found in the deeper layers of the skin, hair follicles, sebaceous glands. And the other group, the transient flora, these are very temporarily, it remains on the surfaces, and these are acquired from the contact, from the environment, from the objects, from the people. And when we look at the pathogenicity and the type, this resident flora are non-pathogenic usually, and these are like Staphylococcus epidermis or Corynebacterium species. These are the common microorganisms found in this resident flora group. Whereas in the transient flora, these are potentially pathogenic organisms like Staph aureus, E. coli, viruses, fungi, and then role the resident flora, it acts as a protective protection to us by inhibiting the growth of other pathogenic or harmful microorganisms, whereas the transient flora does not play any role in prevention or protection. This resident flora are persistent. Even if you wash it, it will regenerate. But the transient flora are temporary, and it can be easily removed with thorough hand washing. And impact on hand washing, as I mentioned, that it cannot be removed completely. Even if you are removing, it will regenerate back. And the transient flora, it can be easily removed if we follow the correct steps of hand washing. And also, by removing the transient flora from our hands, we can get rid of the infection and spread of infections. Moving further, about this transient flora, what are the types? This has been identified by the literature, evidence-based practice literature shows that the transient flora usually comprises of norovirus, which can cause diarrhea and other GI symptoms. Then Klebsiella pneumoniae, which can cause UTI, wound infection, upper respiratory infections, and like that osteomyelitis and all. Clostridium difficile is another group of transient bacteria or transient flora, which can cause diarrhea. It can also cause blood in stool, nausea, etc. Then vancomycin resistant enterococci is another group which can cause UTI. It can also cause wound infections. It can cause lead to fever, swelling, redness, discharges. And another group of transient flora is the Staphylococcus aureus and also MRS, then methicillin resistant Staph aureus. And this can cause boils, meningitis, osteomyelitis, endocarditis, phlebitis, pneumonia, and all those infections. So this is about the resident flora and the transient flora. Now, let us quickly go through, recapitulate the movements, the 5 movements of hand hygiene, which has been given by WHO. I'm sure all of you remember the 5 steps or 5 movements of hand hygiene, which must be practiced at every moment, every time when we are in the healthcare sector, we have to follow these 5 moments. So I would like to request all of you quickly just you can drop down in the chat box what are the 5 moments. I'm sure all of you remember. So before touching a patient, we have to clean our hands. Before any clean or aseptic procedures, we have to do hand washing or clean our hands. After body fluid exposure or wrist to body fluid exposure, after touching a patient, and also after touching patient surrounding, it may be the patient bed or bedside locker, IV stand, anything which is there in the patient surrounding. So after touching all any of this patient surrounding, we have to follow this movement of hand washing. Now, I would like to ask the audience, have you ever observed that any of these moments are going missing during our, in our day-to-day practice? Are we really following all these moments? Or if you have observed, who are the person or the healthcare members mostly misses these moments? Among which group? The doctors, the nurses, the paramedics, the pharmacists, who actually misses mostly any of the moment or most of the moments? Am I getting, are we getting any answers in the chat box as I cannot visualize?
You can see it in the chat. You're not able to see. Okay. So
No.
before touching doctors, they are saying pharmacy. Why pharmacy? I don't know. Before touching patients, after patient surroundings, after touching surroundings, doctors, after touching surroundings.
I'm
So
sure most of them will write doctors. But what about us? Are the nurses following?
I think
Can we say that we are doing 100% all the moments we are doing?
we are not doing. We think we are doing because others are worse. So we think we are good.
Exactly, ma'am. And it is very easy to point out to others. Yeah. Moving further. So let us quickly run through a video showing the moments of the steps of hand washing using the soap and water.
Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.
And there is another video when we use the hand rub. The steps are same. And quickly we'll run through this video.
Please note that this technique is not appropriate when hands are visibly dirty or after using the toilet. In these cases, hand washing is required. Hand rubbing should take you 20 to 30 seconds. Use a timer or count 1, 2, 3, 4, 5 in each of the following steps. Apply a palmful of alcohol-based hand rub in a cupped hand. enough to cover all surfaces of the hands. Rub hands palm to palm, then rub right palm over the back of left hand with interlaced fingers and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. To clean the tips of your fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Once dry, your hands are now clean and safe.
Okay, moving on, hand hygiene compliance, why it is important and how it can be established. When we talk about the hand hygiene compliance, we see that less than 50% hospitals, the hand hygiene compliance in most of the hospital is less than 50%, which contributes to 7.5% HAI in Europe and then 4.5% HAI in United States. If we translate this, 37,000 deaths in European countries, which is related with HAI, and 99,000 deaths occurs annually in USA. Though it is data from 2009, but then recent data also shows that there is not much difference. Adequate thorough hand washing is the single most component or important which can reduce the number of HAI significantly. The studies shows that 10% improvement in hand hygiene is associated with 6% decrease in HAI. So patient safety goals, WHO patient safety goals emphasizes so much on the hand hygiene compliance. There are 6 established goals, and this can be related, each goals can be related with the hand hygiene compliance. While distributing or administering medication, if we maintain hand hygiene, cross-contamination can be prevented. That improves the medication safety. HAI can be prevented. So many times we have mentioned about it that HAI can be prevented with the use of hand hygiene. Then patient's surgical sepsis, that surgical site sepsis or infections can be prevented by thorough hand washing. And also like promoting effective communication among caregivers about why the hand hygiene compliance is important, how it can be done, and what should be done, who should do the hand hygiene, when it should be done. All this communication, it improves hand hygiene compliances and thereby it ensures the patient safety. And again, when we talk about so much about this Patient Safety Movement Foundation USA, they have given so much emphasis on patient safety, and they want to prevent preventable death. They want to eliminate preventable death in the hospitals by promoting best practices, best evidence-based practices, including hand hygiene. So their focus is on creating a culture of safety where every healthcare members and the patients and the relatives will comply 100% with hand hygiene. They also have focused on the implementing evidence-based practices like WHO guidelines, WHO multimodal strategies, all this application which has been evident that it reduces HAI. Then engaging patients and relatives, it also is a focus of Patient Safety Movement Foundation that we have to include the family and the patients in their safety. And another important aspect is utilizing technology. This is the era of technology. So in order to even establish the 100% hand hygiene compliance, technology can be utilized. So let us quickly run through a video how this technology improves or helps us to comply with the hand hygiene.
At any given time, over 1.4 million patients are suffering from healthcare-associated infections worldwide. Healthcare-associated infections can be greatly reduced if healthcare workers washed in and washed out whenever they were in contact with a patient. But there's a problem. Hand hygiene compliance levels are frequently below 40%. Electronic compliance monitoring is the solution. Introducing the Compliance Monitoring System, part of the Hand Hygiene program from Ecolab. The only program that meets all your needs through technology, information, service, and training. This system is different from others because it focuses on protecting patients with accuracy. No other system monitors and reports hand hygiene compliance more accurately. Here's why. The patient zone. This is an electronically monitored zone set up around the patient's bed to detect every hand hygiene opportunity. No matter where the patient is in the hospital, the proprietary bed kit continuously monitors hand hygiene. Here's how it works. The bed kit creates an invisible zone of protection around the patient. The caregiver enters the room. She sanitizes her hands. Upon entering the patient zone, her badge indicates green, safe to interact. After leaving the patient zone, she washes out. A green light verifies compliance. Should she forget, her badge light turns red and can be set to emit an audible beep, serving as a reminder to wash out. Immediate feedback motivates individuals to comply. You've never had access to data like this before. Information is collected and sent through a wireless network. It is synthesized and reported on a dynamic dashboard, which displays actionable data ranging from individual and group hand hygiene compliance to soap and sanitizer levels to equipment battery life. Accuracy is transforming hand hygiene culture. The Compliance Monitoring System brings you patient zone monitoring, immediate action feedback, robust dashboard reporting, and the convenience of little to no IT involvement. It's part of the complete hand hygiene program. Technology, information, service, and training. Helping you decrease the risk of healthcare-associated infections by increasing compliance, in turn improving patient and staff safety, which may also positively impact hospital satisfaction scores. Protecting patients with accuracy. Compliance Monitoring System from Ecolab.
So that was the electronic hand hygiene monitoring system, which is very much used or utilized in the developed countries. And I'm not sure whether it has been used in the Indian sector. Maybe Ma'am Thongkam can shed a light on it later on. So moving further, the importance of hand hygiene in patient safety. Already we have spoken so many times. It reduces the HAI. It reduces the cost in prevention or in taking care of the HAIs. And also it builds up the trust and satisfaction of the patients on the healthcare team members. Now, while talking about the hand hygiene compliance, there are certain challenges which usually the healthcare team members encounters. What are these challenges? Mostly it is the compliance rate, and this compliance rate is not achieved 100% because of the factors such as workload. It may be time constraint, sometimes lack of awareness. So these are factors which reduces the compliances. Then accessibility to resources. If the sufficient resources are not available, like the soap, hand rub, alcohol-based hand rub, or the facility of hand washing, there is no access to clean water. This can reduce the compliance rate, and this can it can be a challenge to the hand hygiene. Also the cultural factors, certain ingrained habits. The person who are very conscious about the hygiene and the sanitation, they will always comply. But there are certain groups who are reluctant. They don't give much importance to hygiene and sanitation. They may stay away from hand hygiene compliance. So these are some challenges which has been encountered in all the healthcare settings. Now, how to improve? The moving further, the strategies for improvement. The best strategy is education and training programs. So every healthcare members, including the doctors, nurses, and everyone from from top to bottom, everyone must be trained, everyone must be educated, and they should be reminded, they should be encouraged. And patient, not only the patient, the healthcare team members, but also the patients and the relatives must be trained and educated to comply with the hand hygiene. Then there should be monitoring system and feedback. Continuous monitoring, regular monitoring, and giving a feedback on time, it improves the hand hygiene compliance. Leadership support is very crucial component. There should be strong management and the leadership support for the compliance of hand hygiene, and also patient engagement. Patient must be engaged for their own safety. They can remind the healthcare members for complying with the hand hygiene. And another strategy is the performance evaluation, or sorry, performance improvement projects or performance improvement plan, which can be taken up in every healthcare setup to find out any deficiencies or gap, and that can be, corrected. So if we want to do a performance improvement project, there has to be like a team. Project team usually comprises of 5 to 7 members, and right person or right member should be chosen. Then this group or the project team should understand what is currently going on, what is the procedure, protocol, or standard practices going on. If there is any deviation, why it's happening, all this has to be looked by this project team. And then they have to prioritize the gap to be addressed and develop an action plan. Where is the gap? Whether it is infrastructure related, whether it is related to staffing or the people's mindset, that has to be identified, and there has to be an action plan. And ultimately, after implementing, evaluation should be done whether the gap has been made, and then celebration should be done. If hand hygiene compliance is established 100%, it is a call for celebration. And if necessary, time to time, the plan has to be adjusted, the action plan has to be modified. Now, let us quickly see who can be the members of this hand hygiene improvement project. So usually the nurses, respiratory therapist, physician, engineering staff, then information technology staff, physical and occupational therapist, laboratory and imaging staff, pharmacy people, then any outpatient providers such as in the primary care, surgery centers or ambulatory care centers, environmental service staff, facilities, then dietary staff, infection control specialist, student residents, clinical educators, information technology people, patient and family members, this secret shoppers or safety champions. These are the person, like these are deliberately appointed people who will be in the group. They will not reveal that they are they are being appointed to observe or monitor something related to hand hygiene compliance, but they will be in the group as a just normal worker along with others, and they will secretly monitor. And then housekeeping staff and public health promotional specialists. So these are some categories from where we can choose the project team members. Usually, as I mentioned, 5 to 7 members are enough. And then what to consider, what need to be assessed. First of all, we have to see whether provision of hand hygiene is, all these provisions are available. Placement of sanitization center, alcohol and soaps are, how much, it is half filled or it is empty. There's liquid soap or hand rubs, whether dispenser are adequately placed, availability of, the clean water, all this has to be assessed during this project improvement plan or project. And then next is that how much education and promotional activities are carried out for promoting hand hygiene among the community people, among the patients, among the healthcare team members, and what sort of messages are being displayed, then what kind of opportunities are given to the patient to engage for their own safety, and how much promotional activities are done for public awareness. All this has to be considered to assess during this uh, performance improvement projects. Also, we have to see the workflow, whether every group of healthcare team members have a routine workflow. Then whether floor maps has been provided about the hand hygiene equipment placement, then whether hand hygiene performance assessment is done in every shift, monitoring with the compliances after PPE, removing of PPE, whether hand hygiene is done or not, identifying the reasons why there is non-compliance and the categorizing why, say because of infrastructure problem or any resources constraint, what is the reason. Then also they have to assess the action items for compliance categories, and also the variations in hand washing, whether all the movements of hand hygiene or hand washing was followed or is followed, and what are the methods followed. I mean, that how much time is being spent for hand hygiene, and tracking also tracking the hand hygiene compliance based on the patient volume, whether like when there is a huge number of patient, the compliance rate decreases. This kind of thing has to be considered to assess. Also, like availability of hand hygiene station near the patients. So these things has to be assessed in the workflow. And also we have to observe like how much patients are engaged for hand hygiene behavior. Also the system of gathering report, what sort of checklist or the process is applied for gathering information. Also we have to see like the compliance goal, how much it has been set, is it 100% or less than that. Then healthcare professional, another important assessment has to be done, like how the healthcare team member takes it when something is being implied. Suppose performance evaluation project, improvement project is been planned, how is the reaction, what is the reaction of the health team member, whether it is they are taking it as a burden or they are taking it positively, that has to be also considered to be assessed. Now, certain gaps which has been identified while taking up this kind of projects are in the data collection. If process is not done correctly, accurately, it may give to a wrong result. Even the observers or the like person involved in the data collection, they have to know their roles. Environmental, like certain complexities in the environment can be a threat to, to give rise to certain gaps. And then emergent patient needs, if there is any emergent situation that may also hamper in the hand hygiene compliance. Then henceforth, when we are loaded with so much of work, that time also there may be non-compliance of hand hygiene. So these all things need to be considered while while implementing the performance improvement projects. Also, the typical gap is in cultural area, like lack of incentives being aligned with the performance. This is a gap which has been identified very commonly, that if people or the staff members are complying with the hand hygiene, they are not given proper recognition. Lack of person-specific accountability, lack of recognition, then little organizational focus on hand hygiene, inconsistent communication, misinterpretations, misperception. Misperception that hand hygiene only should be done while using gloves or while after removing gloves. So that kind of thing also may happen in the healthcare setup. Then certain like gap is identified in case of staffing. It's a big gap actually. When there is lack of staff, adequate number of staff are not available, then workload will be definitely more, and at that time the hand hygiene compliance might decrease. And inconsistent education of new protocol, if something new has been devised or revised or modified, that has to be taught or told to everyone. Then new or visiting staff members, it happens because of staff shortage, too much of turnover. Every now and then we have to recruit new staff, and if they are not trained, they are not reinforced to do hand hygiene, then there may be some problems. Then staff in skin irritation. Yes, too much of hand washing sometimes can cause irritations of the skin or skin damages, and then the staff or the healthy members may be reluctant to do frequent hand washing. And lack of assessment of patient barriers. Sometimes we do not assess whether patient is having a pain or like some mobility issue, and that in that time patients hand hygiene compliance may be low. And infrastructure related gaps which are identified in some of the improvement projects: access to clean water, soap, hand sanitizer, plumbing of sink availability, wasted water and efficiency of water use, lack of adequate supply. These are certain gaps which has been identified while implementing performance improvement projects. And also there are certain matrices which needs to be considered while doing this assessment. One is outcome metrics. How much we are able to control the infection transmission, that Clostridium difficile or MRSA rates, are they increasing or they are decreasing? The average length of stay of patient in the hospital, whether it is increasing or decreasing, or it is like the normal, and the transfer to ICU or higher level of care from from the patient ward or cabin. If the patient needs to be transferred to the ICU, that tells us that the infection rate is more and problem lies there, and it tells us the compliance rate is less. That these are the outcome matrices and the process metrics which need to be as considered for assessing the hand hygiene compliance. The environmental safety checklist use of PPE, traffic in and out of patient room, use of alcohol versus hand soap, post dishes, post service surveys with the question whether hand hygiene is maintained. Did you observe your providers hand washing their hands? Did need to be asked. The patient needs to be asked whether their healthcare providers are complying with hand hygiene. They are washing their hands before coming, before touching them. And also another process metric is giving due recognition to those staff member who complies 100% with the hand hygiene. So these are the matrices which can be utilized. Now, moving further about the very important component of hand hygiene is the education of patient and the family members. So patient has to act there for their own safety. So we have to tell the patient who they may encounter, like the surveyors or volunteers or educators who will come to them to assess whether they have done the hand washing, or to give the education or training to them. Then also you have to ensure that the patient understands like why they should hold an expectation from their providers hand hygiene. Then also we have to assess like how we do the patient's assessment, head to assessment. Also, this assessment component need to be incorporated whether patient has done their hand washing. Have you washed your? Need to be asked to each and every patient, every shift, every day. We have to also inquire certain barriers in the patients, like while doing the hand hygiene. Maybe because of pain, they may not be able to come out of the bed to do hand washing, or there may be mobility issues, or there may be other issues which is hampering practicing hand hygiene for the patient. Then also we have to see when they are doing the hand washing, the patient or the family members, whether they are following the correct steps, all the steps of hand washing after teaching them, whether they are really complying to it, they are doing this correctly or not, we have to assess that. And also we have to provide promotional material so that every family members, they ask, not only family member, the patient asks the doctor and the nurses about compliance to hand hygiene. Continuing with that, patient education, the setup of the patient environment to remind them to perform hand hygiene. While serving the food, there should be some kind of reminder can be given. While doing any type of your hand hygiene, reminder should be given to the patients so that they do not forget. Then outpatient setting, there should be some posters, some kind of advertisement which emphasizes the importance of hand hygiene. And then verbally emphasize the patient the moment of hand hygiene. It is not only that the health team members remembers the moments of hand hygiene, but also the patient and family members need to know what are the 5 moments they can ensure. If any moment is going missing, they can identify and tell their providers, and illustrate the direct link between the hand hygiene and the implications of care. And also we have to ensure that family members understands their capacity when they do not do hand washing, how much infection they can spread. Maybe a good example is that video madam has played in the beginning, like how we turn yellow not washing hands. Also we have to engage in conversation about the patient's family, how can they help by maintaining hand hygiene, how can they help their own their loved one. And the hand hygiene education for the family and for the patient should be on the basis of their understanding, their level of understanding. We should not use complex words or medical jargon, but it has to be very simple so that they understand and they can follow. Now, so now moving on to certain research findings or research articles which has been published in the journals in regard to hand hygiene practices. So this is a study which has been published in American Journal of Infection Control about the outbreak of norovirus in a long-term care facility. So this has been like the investigation revealed that poor hand hygiene practices among the residents contributed significantly to the spread of this virus. And author emphasized that hand hygiene need to be very strictly adhered. And another study which has been published in the infection control and hospital epidemiology about the relationship between hand hygiene compliance and healthcare associated infection. The study found that increased compliance decreases or reduces the HAI. Another study published in Hand Hygiene in BMC infectious disease about the impact of hand hygiene education on infection rates. This also has demonstrated that there is notable decrease in infection rate among patients after demonstrating the healthcare, after demonstrating the hand hygiene procedural steps. And there is another study which has been published in the Journal of Hospital Medicine, the role of hand hygiene in preventing Clostridium difficile infection. It has shown that the strict adherence to hand hygiene has reduced the CDI rates, and it also give importance for hand washing protocol, rigorous application of hand washing protocol. And this is another study about the importance or the evaluation of alcohol-based sanitizer during influenza outbreak. This study was published in Clinical Infectious Disease. It has shown that while using the alcohol-based sanitizers, it can effectively reduce the influenza outbreak, but then it also shows that people are not knowing how to use it. Many of them are not using it correctly. And that's why it is leading to the more infection rates. So these are the studies, or there are plenty of studies. I have gone through so many research studies, and I was surprised to know that so much studies has been conducted on hand hygiene. Now coming on to this WHO's multimodal hand hygiene improvement strategy, which has been designed by WHO, and it has been recommended for every healthcare organization to follow, and which has significantly reported to reduce the hand hygiene, hospital-acquired infections. So this multimodal hand hygiene strategy tells about 5 strategies. One is the build it, that is the system change, to build a a system where there will be provision of all the required things. Then check it, the monitoring and feedback system. Next is leave it. That means we have to we have to apply, we have to go all the time, we have to comply. And next is training and education. And lastly, the component or the strategy is reminders in the workplace and communicating to all the members of healthcare team to adhere to the hand washing protocol or hand washing steps. So this is a 5-step or 5-point WHO's multi-modal hand hygiene improvement strategies. So moving further, to summarize the topic which we have discussed so far, hand hygiene is the cornerstone of prevention of HAI in the hospital. To improve compliance, monitoring through electronic system or direct observation, education, real-time feedback are very, very essential. Engaging patients to remind healthcare workers and using multimodal strategies like training, workplace reminders can drive a long-term improvement. And finally, effective hand hygiene practices significantly reduces HAI, enhances patient safety, and lower healthcare cost, underscoring its critical role in any patient safety program. So this is all about hand hygiene. Thank you so much for your patient hearing. And if there is any query, it can be dropped into the chat box. Over to you, ma'am. Thank you so much.
Thank you, Papuri. That's a very in-depth diving into hand hygiene, where everybody thinks it's a very pretty basic topic. Why should we be deep diving? And believe me, after being in healthcare system for 44 years, I see it still as a challenge. So we would like to open the floor to the participants here in case they have any questions, or if they have any anything that worked for them positively to improve the hand hygiene compliance, you may share. We have few minutes. I think we can take about 3-4 minutes for feedback. Please, the floor is open to the audience. Everybody's quiet, filling their feedback from for the certificate.
Right.
So I can only tell one thing. The one intervention that really worked in my experience was to actually teach the patient and family that it is your right that anyone who comes to look after you, they must do the hand rub, the fluid that is kept on your bedside. People should pour and they should be doing like this. We actually taught the patients, and then the patients became their own champions. If we educate them and tell them that they have to use it because for your own safety, if they don't, they may bring some germs from other patients to you, then they are really concerned. So they don't mind even telling the doctor, please use the hand rub before touching. So that was one way of getting a better compliance, but that still does not answer the problem of not using the right process of hand hygiene. Whether you are doing it for 30 seconds, whether all the steps are being followed. So that is another thing. So someone asked me a question, how to do the QIP on hand hygiene. It's a good idea to follow the WHO multi-model strategy, and also include the audit of the infrastructure, that whether you have enough wash basins, your soap solution quantity, and whether hand rub is available. Those things needs to be audited, and plus we should also look at the process, how the people are using and how they are doing the hand rubs along with the 5 moments of hand hygiene. And Papuri, that was a nice video at the end about the technology. I'm not aware of any hospital using that in India because the way that they have described. Okay. So someday maybe somebody is already working on it. We don't know. So if the technology comes, then, the manual thing of auditing the hand hygiene compliance can be helped. Maybe you will get better picture of the compliance. And I also like the idea of the secret shoppers. See, secret shoppers are it's modality to check any services. Any services, it can be used in hotels, it can be used in hospitals. So I know that many years ago when we were commissioning our hospital, so we had uh, people who were getting admitted, though they were not patient, but they had some complaints, and they were admitted to check our own processes. But the nurses and the doctors on duty, they were not aware they are actually secret shoppers. So they were told that you have to give us the feedback. How was your experience? So those people can definitely tell us, so that's the same concept. It's like secret shoppers can be available in supermarket to check how their people are treating the customers. Okay. We can do secret shopping in front office, looking at how the nurses or the front office assistants, how they are behaving. So it's a very nice concept, that you can use for many different purposes to see whether it is working or not. So great session, Papori. Thank you very much.
Thank you, ma'am. Thank you so much.
And so since there are no questions and no comments, thank you very much for joining. We have 100+ participants here. Thanks to your team. So a lot of people have joined in. And please watch
And
out.
thanks to you only. It is only because of you it became possible, ma'am.
No, that's what I love to
You have
do.
really inspired. And my students and my colleagues, they are so much inspired by your, all the actions you do, ma'am. It's really
Thank you.
inspiring.
Thank you. I think each one of us, if we do our bit, the world can be a better place. That's
True.
all I can tell. Yeah.
Yes.
Oh, thank you. And great session. And this is getting recorded. It will get uploaded so more people can watch. I really hope all this learning series, the academicians will use to show to their students, it's a very free learning available. People should use that. So with that, thank you everyone and Shaba Khair, good night. And
Good night, ma'am.
in next month with another learning series, and that is about pressure ulcers, another interesting topic. Yeah, great. Thanks, Papuri. Good night.
Thank
Bye
you.
bye.
Bye, ma'am.